How do doctors use CORT scans to diagnose stroke? Imagine a quick, detailed snapshot of the brain that can tell us what's happening inside in just minutes. That's what a computed tomography scan, or CORT scan, does when doctors are trying to figure out if someone is having a stroke. When someone shows signs like sudden weakness, speech trouble, or confusion, doctors need to act fast. The first step is usually a non-contrast CORT scan, which doesn't require injecting any dye. This scan can spot bleeding in the brain, which appears as bright or hyperdense areas. If bleeding is present, it's a hemorrhagic stroke, and the treatment approach changes immediately. But if there's no bleeding, the doctor then looks for signs of ischemic stroke, which happens when a blood clot blocks blood flow. Early signs of ischemia might not be visible right away, especially within the first few hours. That's why a normal initial CORT doesn't always rule out a stroke caused by a clot. To get a clearer picture, doctors may perform additional scans like CORT angiography. This involves injecting a special contrast dye into a vein, which travels through the blood vessels and highlights the arteries supplying the brain. It helps identify blockages or narrowing that could be causing the stroke, especially large vessel occlusions that might be treatable with procedures like clot removal. Another advanced technique is CORT perfusion, which also uses contrast dye but focuses on measuring blood flow in the brain tissue. This helps determine which parts of the brain are still alive but at risk, known as the penumbra, versus areas that have already suffered irreversible damage. This information is crucial, especially when patients arrive outside the usual treatment window of 4.5 hours. It can extend the window for certain interventions up to 24 hours after symptoms start. Doctors interpret these scans using standardized tools like the Alberta Stroke Program Early CORT Score, which helps assess the extent of early ischemic changes and predict how well a patient might recover. While CORT scans are the go-to imaging method in emergency stroke care because they are fast and widely available, magnetic resonance imaging, especially diffusion-weighted imaging, can detect early ischemic changes more sensitively. However, MRI takes longer and isn't always accessible in urgent situations. In essence, CORT scans are vital for quickly distinguishing between bleeding and clot-related strokes, locating blockages, and assessing brain tissue health. This rapid imaging guides critical decisions like giving clot-busting drugs or performing mechanical clot removal. Following current stroke guidelines, this approach helps maximize the chances of a good recovery. Always remember, if you or someone else shows signs of a stroke, seeking immediate medical attention is essential, and healthcare professionals will use these imaging tools to provide the best care possible.